Hello, I am Dr. Amit Kumar, DM Nephrology from SGPGI, Lucknow. I am a nephrologist and renal transplant physician in Ranchi, and I'm attached with Medanta Ranchi last 3 to 4 years. So today I want to share something about our specialty, that is nephrology, for common public understanding. So major diseases associated with comes under this nephrology is kidney disease is categorized mainly into acute kidney injury and chronic kidney diseases. Acute kidney injury, the kidney injury or increased in level of creatinine or altered routine urine parameters, that is of shorter duration, and chronic kidney disease includes the changes in renal parameters, either anatomical or in biochemical parameters for 3 to more than 3 months duration. Common risk factors associated with chronic kidney disease are most commonly is diabetes mellitus. It affects a lot, and it is a very common problem in our country. That is also associated with some genetic reasons. This one, like many of your behavioral style, your food habit, your how you take food, and many of your surroundings causing toxins or any pollutants that may lead to this particular of disease, and this disease leads to metabolic syndrome in many cases. That includes other diseases like obesity, dyslipidemia, hyperuricemia, and that further affects your heart, leading to coronary artery disease, and it has many implications and many comorbidities associated with this. So today I will focus on a small, you can say a drug that is essential in patients with chronic kidney disease who is having volume symptoms, like patients who are coming to us having edema, swelling of the bilateral lower limb, or facial swelling or periorbital swelling. Also, he is complaining of, there is shortness of breath, or he is not able to complete his sentence, and he feels disturbed or feel uneasiness on lying down position or walking for a while. So, in this, the diuretic act very rapidly, and it has very good symptomatic benefit by increasing your extra salt and water through the kidney. So group includes diuretic, comes mainly loop diuretics and some thiazide diuretics. Most commonly used diuretic in chronic kidney disease patients, that is mostly come to us of GFR less than 60 or less than 30. Then this torsemide. Torsemide is commonly used, and it is very you can say very beneficial if used at appropriate dose and in a appropriate time. So any patient who is having these particular symptoms, so they get relief very quickly by using diuretics, and of course they also should give an advice of taking less of salt and less of water. And many other drugs like antihypertensives, or if we discuss about chronic kidney disease, they also having like anemia, they having all the bone parameter, changes in the bone mineral density, or you can say decrease in calcium, sometimes increase in phosphorus level, your alkaline phosphatase is increased. So in that cases, many drugs like calcium phosphate binders are used. For anemia, mostly iron tablets or erythropoietin. If it is not corrected by iron, either oral tablets or IV, then there is a role for the erythropoietin. So starting from the diuretic, your antihypertensives and drugs, curing your, controlling your blood sugar levels and other supportive management by this iron tablets, or you can say calcium and phosphorus tablets as per requirement, has a good role in giving. One is symptomatic relief, another is you can say the decreasing the progression of the disease. Although this disease should be checked at early stages by simple screening test of routine urine examination or your test of creatinine levels, that may give you clue for either the patient is suffering for chronic disease or not. So always prevention is better than cure. And when the disease progresses and GFR comes less than 15 or less than 10, then only two options left, that is either renal transplant or lifetime dialysis. So we must, you can say, we must identify this particular disease in earlier stages, and we need to prevent it by modifying our modifiable risk factors that causes this chronic problem. Thank you so much.